Do you have any involvement there in examining or identifying wounds of deceased individuals?
I did. My office was in the medical building, and it was very close to what was the equivalent of the urgent care center on site. And so when the patients would come in with an extreme injury, a very serious injury, or near death, I would frequently go over right to the urgent care because that was my specialty. That was, my interest. And even though there was a doctor or another practitioner assigned to care for the patient, I would oversee that. And I would also, examine the patients, look for wounds, look for, signs of injuries. There were some, in some of these cases, there were some deaths, and I would examine those bodies very carefully for any kinds of wounds, just like I had done in the coroner's office for those years.
To move this along, before you became the chief medical executive at Corcoran, where did you work and what did you do? So
I worked for 29 years, I worked at what's called the Los Angeles County USC Medical Center. Now, I know that's a lot to say. It was a county hospital that was affiliated with a medical school. It used to be called, prior to that, prior to when I got there, it was called General Hospital. It was a 19-story building, General Hospital, well known. And now it's actually called LA General or something of that nature. So, anyways, that's where I worked for 29 years. And as I said, I had a variety of different roles there.
Can you just briefly name off the roles that you had while at the General Hospital?
So, as I mentioned earlier, there was always a clinical component to what I did. I always had shifts in the emergency department where I had to see patients and supervise interns, residents, physician assistants, nurse practitioners. So in addition to seeing my own patients, I would also supervise them as they were seeing their patients. So that was the clinical role. Then there was an administrative role, and my administrative roles ranged from director of what they called life support training, which provided training to the trauma surgeons and the neurosurgeons regarding things such as advanced trauma life support, and also to ER doctors. So director of life support training, director of QA. For many years I was director of the jail unit, which was a very unique unit at this hospital. For a hospital, it was a very unique unit in that it had three components: a dedicated ER, for jail patients or patients in custody, a dedicated clinic for in custody patients, and a dedicated inpatient. So it's three sections dedicated to in custody services. I was medical director of that for a while.
In addition to all that, were you also a professor?
I was an assistant professor.
Assistant professor. And what did you teach? Just a brief summary of what you taught.
Well, most of my teaching was clinical, bedside teaching, rather than in lecture halls. I would occasionally give lectures to the residents, the residency group, which was about 50 doctors.
And those residents are medical doctors, correct?
Yes, they are. Yes,
Yep.
they are medical doctors. So I would occasionally give lectures to them, but a lot of the teaching was actual bedside teaching.
Switching gears just a little bit and segueing, over your course of your career as an emergency department physician and otherwise, did you treat individuals with animal-inflicted injuries?
Yes.
And did any of those animal-inflicted injuries involve dogs?
Yes.
And generally, is it correct to say that in terms of dogs, there's sort of the canine police dogs, and then there's the civilian dogs with which most people have experience?
Yes.
Are those two categories that you're familiar with, you're comfortable, as we discuss dogs, to have canine versus civilian?
Yes, because the injury patterns are a little different.
Okay. So what is the difference between a canine dog on the one hand and a civilian dog on the other?
Well, generally, civilian dog bites are rather minor, generally. Puncture wounds, maybe, some slight avulsions, skin defects, slight skin defects, usually not major. Whereas in the canine or trained police dog bites, the wounds the wounds I saw, were extensive wounds where there was extensive ripping, tearing, crushing of tissue, and many times even injuries to the muscles and blood vessels underneath.
From your experience, do you know why the injuries from a canine dog are as you describe them, as opposed to injuries from a civilian dog?
Well, in the LA area at that time, the dogs were taught to bite and hold. So they would, the canine dogs would get a grip on the individual that they were pursuing, and then hold on, even if the individual was trying to pull away. And so there were oftentimes tearing injuries to those, because that's how the dogs were trained at that time.
Even with canine dogs, did you ever see injuries from canine dogs on humans that were not a complete bite, that were an incomplete bite?
Yes. So if the dog missed on the first attempt at a grab, the teeth might only scratch the surface of the, usually extremity, by the way. And so you'd get what I'd consider an incomplete dog bite, because it was just scratch marks from the teeth. But the dog would then, try a second time and third time.
Now let's go to civilian dogs, a term used for more dogs of household pets that people have. Can you describe from your experience the type of wounds from those civilian dogs that you would see, and contrast it with what you just described for a canine dog?
Generally, they were minor. So a scratch, a puncture wound, maybe a little tearing of the skin, a little skin flap, but generally much different.
In your did you say about over 30 years experience in the emergency medicine department? Mm-hmm. What did you see more of? Civilian dog wounds on humans or canine wounds?
Actually, it depended on where I was assigned at the time. So in the very beginning, because the jail unit was one of my first assignments, I saw these terrific, horrific wounds, many of them, I learned that what was in the textbooks about how to treat them was so wrong, because these patients many of them needed hospital admission, intravenous antibiotics, and many of them needed surgery. And what I was reading in the textbook was, that you could patch them up and clean up the wound and send them home with, sometimes with antibiotics, sometimes without. But anyway, so initially what I was seeing a lot of in the very beginning was the law enforcement dog bites, because I was assigned to jail ward. And also I was very interested in this because I used to be a police officer. And before going to medical school, I was a full-time police officer here in Massachusetts for 7 years. And so I had this interest in law enforcement type injuries sustained during the arrest process, et cetera, et cetera.
So you had an early interest with regard to dog-inflicted wounds on humans and a police officer. Where were you a police officer in Massachusetts, and when?
In the city of Malden. I was appointed as the first woman police officer in 1977 to 1984, full-time.
And while you were a police officer, were you doing that full-time And anything else while you were a police officer? Were you pursuing school while you were a police officer, your college education, or was it separate?
No, I was a full-time police officer working the night shift, and I was attending Northeastern University part-time during the daytime to pursue my degree.
Were you a sworn duty police officer?
Yes.
Full member of the police force?
Yes.
Did you attend academy?
Yes. I attended the Boston Police Academy.
And how many years were you a Boston police officer?
No, I
I'm
wasn't.
sorry, I'm not Boston, the Walton.
I was a Malden police officer for 7 years, full-time.
Now let's go back to your emergency department and other experience. Can you approximate how many dog bite injuries you provided treatment for while an emergency department physician?
Overall?
Overall.
Well, I don't know the exact answer, but I estimated it at a very conservative number of 500 dog bites because, would you like my methodology?
Oh, please.
Oh, okay. So I considered that even though I worked there for 29 years, I would take 25 years and 40 weeks out of the year, because the other weeks I might be assigned something special, a special rotation or a special assignment or vacation or some kind of course. So 25 years, 40 weeks per year, that's 1,000 weeks. So even if I only saw one dog bite at this busy trauma center, that would be 1,000 dog bites in my career. But I just took it in half. I cut it in half and said I think at least 500.
In addition to the 500, did you oversee other physicians or healthcare professionals like physicians' assistants, nurse practitioners, who themselves were treating and observing dog-inflicted wounds on humans?
Yes.
And approximately, just the number, approximately how many of those, in addition to the 500 you just calculated?
Well, I generally supervised about 3 to 4 people per shift. You know, med students and interns, residents, whatever, all those people. And so I would say very conservatively another 500.
In terms of other work, I want to shift just a little bit in the emergency department. Did you encounter injuries from persons involved in motor vehicle accidents?
Many.
And you mentioned you were in Los Angeles. And in terms of those, can you approximate how many humans you saw and treated and diagnosed in the emergency medicine department from motor vehicle accidents?
Well, it was a very busy level 1 trauma center.